Reconstructive options in oral cancer surgery will range from nothing, that is primary closure, to a local flap, to a regional flap, to a free flap. Now, local flap is a flap which we devise in and around the particular subsite. For example, if it is buccal mucosa, we would harvest a part of a palatal mucosa over the palate. I am Dr. Snehal Shah. I am a robotic throat cancer surgeon based in Mumbai. Now, if it is a regional flap, then the flap is taken either from the chest, which we very famously call as PMMC, pectoralis major myocutaneous flap, or PMMF, which is pectoralis major myofascial flap. Not only PMMC or chest flap, we also harvest something which is called as deltopectoral flap, or if there is something called as latissimus dorsi flap, which is also harvested with a better reach and more coverage. So LD flap, PMMC flap, PMMF, or for that matter DP flap are the regional flaps, but there are by and large many other flaps which can be harvested, which can be used for reconstruction of oral cavity. Coming back to local flap, not only do we have a tongue flap or a palatal flap or a fam flap, we also can harvest a nasolabial fold flap or a supraclavicular flap, or for that matter infrahyoid flap or submental flaps are used with good cosmesis and with good control rates. These are used. Coming to distant flaps, which we call as the free flaps, which is a standard of care today. I am Dr. Snehal Shah. I am a head and neck surgeon. I am a robotic throat cancer surgeon based in Mumbai. Now, coming to free flaps, there are a wide range of flaps, but the ones which are predominantly used are forearm free radial artery flap, or for that matter free anterolateral thigh flap, or free fibula oro-osteocutaneous flap. But there are other flaps which are also used, such as a parascapular scapular system of flaps, or for that matter iliac crest, that is a bone which is taken from the navel area, or for that matter the bone taken from the wing of our shoulder. These flaps can also be used, or there are rib flaps which are also used to reconstruct. So it is bone for a bone, soft tissue for a soft tissue. If we remove bone, we can replace it with the bone flap. If we remove a soft tissue, that is no bone, only skin, a buccal mucosa, that is a cheek ulcer, or for that matter a tongue, we can replace it with a soft tissue, something like free radial forearm artery flap or a free ALT flap. Thank you.